Hello, everyone. Welcome. It is the day one of our December 25 World Congress on Planetary Health, and we're going to dive into an office hours, which has actually been a really fun staple to have over the past couple of sessions. So again, we're going to do some office hours, more focusing on policy this time. Dr. Steve does have some updates on psychedelics, particularly MDMA, which is one of the molecules that has had so much media attention and so much research highlight, and has also really had a lot of conversation around policy. So I'm excited to hear updates there. And then I'm going to talk a little bit about US cannabis policy. If we have time, I might touch a little bit on the Colorado specific psychedelic landscape. I wanted to talk about Ibogaine and some of the things we're seeing come up, new policy emerging and some of the service animal, therapy animal implications, but we'll see if we have time to drop into that. Okay, so that's what I have for introductions. Again, welcome. Thank you too for being on live with me today and for everyone who's watching after the fact. So Dr. Steve, welcome. Thank you so much for being with us today.
Yeah, greetings everyone. So, a brief introduction. My name is Dr. Steve Kruzeniski. I'm a veterinarian originally from Canada, but have been living, working abroad, mostly in Latin America, but in many different parts of the world through a variety of NGOs, and now find myself in the Sacred Valley of Peru, where I've been for the last 5 years. I combine my work of social veterinary care and also a focus on mental health for our practitioners, our healers. And then also last year completed a psychedelic assisted therapy program. So I've really been interested in the One Health connections, or the connections between our humans, animals, fungi, environment in general, ecosystems, of how they emerge with this new or re-emerging psychedelic landscape, both in the US and worldwide. So happy to be here today. Thank you for the invite, and happy to have been a part of this journey since 2003 or before that, of introducing these conversations to our community. And I've been thrilled with the turnout we've had, especially exciting in the last couple sessions. We've had really good conversations as we're starting to kind of explore some of these unknown topics in our world, and bringing in different perspectives, and case studies of how we're starting to see things show up in the veterinary world. Um, so today I'll be discussing kind of what we know now of kind of the new MDMA regulations in the United States. The last time we discussed MDMA was a couple of years ago, and we're kind of on the verge of what we thought was going to be rescheduling, FDA approval of MDMA to be used in therapeutic contexts, and there's been some kind of hiccup since then. And so some important things to discuss, what those changes were, how they are maybe affecting the human realm, what the path forward. And then what I'd like to try to do is to bring in kind of a One Health context into this as well, as we always do. How might these changes affect our patients? What are still some of the things that we're concerned about or we see as promising, both from animal patients and the environment in general? As we get started, again, what I'll talk about today is kind of this MDMA regulation in the US, and try to bring in a systems story into it, not just a clinical one. This is about promise, but also a pause, and what happens when medicine, culture, regulation, animals, and the environment all intersect. So I'll briefly cover what MDMA is, again, just for a quick review, why there is so much excitement around it, what created this pause that we're seeing now, and what a One Health perspective adds. So this isn't really advocacy or opposition, it's just context for what's occurring in the US, and also try to bring a global context too. So MDMA, also now being referred to as methamphetamine, in regulatory context, is not just a classic psychedelic. It's an empathogen, or also an entactogen, that increases serotonin and oxytocin, and reduces fear responses. And so a little bit different than some of our classical serotonergic psychedelics, and known for its very kind of warming, opening effects in many cases. So clinically, this can allow people to revisit traumatic memories without becoming overwhelmed by them. So important to know that MDMA doesn't erase trauma, but it seems to change a person's relationship to it, give it a different perspective, allow you to maybe go into some of those traumatic events and see them from a different viewpoint and be able to relate to them different and then kind of recategorize them differently. And so this is why it had a lot of promise in general, especially what was being studied was for PTSD. So MDMA assisted therapy has mainly been studied for treatment-resistant PTSD, particularly in veterans or trauma survivors. And unlike daily medications, it's used in a small number of supervised sessions and combined with psychotherapy. So this was the MAPS or Lykos protocol that would often treat one, two, or three times, depending on the trial, and join that with psychotherapy before, during, and afterwards. And early trials showed kind of large effect size and meaningful functional improvements for some patients. It was given breakthrough status by the FDA in those stage one, stage two trials. And given the unmet needs in PTSD care, the optimism was quite understandable. And I think there was big movements of trying um, to go with this, and I think a lot of hope that went along with this because it did seem to help a lot of people. But there was, yeah, and so we saw some kind of early 2023, early 2024, strong momentum towards FDA approval. So a new drug application was submitted, and many assumed approval would lead to rescheduling and broader clinical rollout. And then, as Dr. Casara mentioned, there was a lot of media attention, public hope, and it accelerated quite quickly. So expectations in many ways ran ahead of regulatory systems, often saying it was just around the corner, it's almost there. And then this was interrupted. So August 2024, FDA declined to approve MDMA-assisted therapy. This wasn't a declaration that MDMA has no therapeutic potential, but rather more the FDA concluded that the evidence presented did not yet meet the standards required for approval. And it's best understood as kind of a pause, but not a full-out rejection. So to try to go into kind of an overview or a little bit of what was discussed. And actually, there has been the letter made publicly available, which doesn't always happen. So it gives a little bit more of an insight into detail of why it was not fully accepted. But in general, the FDA raised concerns about inconsistent definition of adverse events and incomplete safety reporting. So kind of saying this was no single consistent definition of an adverse event across protocols. So as these studies were not just at one certain place, they were often had approved sites across the US that were trained in giving this. And it seems there was maybe different definitions in some of the protocols in each different site, which made it harder for the FDA to get on board. And some effects that felt subjectively positive, like euphoria or emotional openness, weren't always captured as safety signals. And so I had to look into this a little bit more of what that meant. And so MDMA very consistently gives this kind of euphoric openness, and it's almost for people who work with it consistently, almost an expected result. But this wasn't maybe always clearly noted. And it can be difficult for us to say, okay, well, this is a good thing, right? This is often a good thing for therapeutic contexts. This is why it's being used. But I guess from the FDA's standpoint, that no matter what, if it's a negative adverse effect or a positive effect, it needs to be noted and clinically documented so that they know what they're working with. And so then I think from this, some of the explanation over this, maybe more abuse potential if it's positive, both from kind of the client perspective and from a therapeutic perspective, that thinking if this is going to be rolled out across the country or different places, that it needs to be known and well documented what these positive effects are, because then we need to know how to regulate them or control them or know what the potential risks are, even in the face of a positive a positive demonstration. And so maybe something we can talk about in a little bit more detail afterwards. So from a regulatory perspective in general, this makes it hard to assess real world risk and abuse potential. Without a complete safety picture, approval becomes more difficult from their perspective. Okay, so other things are kind of continuing with this of what the FDA had concerns about. And they also question whether benefits last long enough for chronic conditions like PTSD. So the follow-up periods were relatively short, I think about 18 months, and longer-term data had limitations. And additionally, a high percentage of participants had prior MDMA experience, raising concerns about bias and generalizability. Regulators need confidence that benefits persist and apply broadly. And so some of these things they thought maybe muddied the water or were just not clear enough for them to give full drug approval. And so um, from the community's perspective, from Max, I think MAPS and Lycos, and the broader kind of MDMA therapeutic community were kind of blindsided by this, and reading some of their responses, thinking, there's such a need for it. There's so much kind of PTSD that's being untreated and left, and that they were following every step, and then they felt the goalposts had kind of been moved. So ethical concerns, including some other concerns of ethically related the FDA brought up were ethical concerns, including therapist boundary violations, also weighed into the FDA's decision. And at the same time, many in the psychedelic community, like I was saying, feel that they moved the goalpost. So as expectations evolved during review, um, they the community felt they weren't properly notified or given an indication that these changes were made. So, like I said, it took a lot of people by surprise, but they're starting to get a further understanding. So, in general, I think both perspectives can be true. Innovation maybe move faster than clear regulatory frameworks. And this tension isn't always unique to psychedelics, but amplified here. I think it's important to kind of acknowledge that some of the FDA's concerns reflect broader structural challenges in studying psychedelic therapies in general, right? These substances are inherently difficult to blind. Participants and therapists often know when the active drug has been given versus when they're given a placebo, which can complicate traditional trial design. MDMA is also intended to be used along psychotherapy. And this is also another kind of hang up I know that was occurring because as MAPS presented it, and there's a lot of, as we're aware, that integration, preparation, and psychotherapy is extremely important in these psychedelic conditions. This is new realm for the FDA, right? They're tasked with evaluating drugs and not therapy models or relational dynamics. And so, with the approval of the drug, I think went into it that it wasn't just the drug, but that therapy was needed. And this made it, I think, more unclear for the FDA of what could be approved because essentially they weren't just approving a drug, but a whole system. And I think this creates a mismatch between how the treatment works and how it's regulated. And it contributes to the sense that expectations shifted as the field matured. And so this is an ongoing thing, not just for MDMA, but psychedelics in general, that, how do we study these the same and how and trying to follow what the protocols or regulations that the FDA has set out can make it a little bit more difficult because they're just not, it's not as clear of a placebo, and there's other things that have to be taken into consideration that maybe the FDA wasn't ready to be able to address. So more of a global context to know what's going on in MDMA in general. The US isn't the only country navigating MDMA regulation. Australia has moved forward, but under a pretty tightly controlled, authorized prescriber model. I think quite expensive and quite limited. So, but they were the first ones to make it approved. Canada and Switzerland allow limited access through special or compassionate use pathways. Globally, we're seeing cautious, stepwise experimentation rather than blanket approval or rejection. But typically, as it goes with everything, the US's decision often kind of relates to how the rest of the world responds. So if things move forward with the US, I think that'll probably be usually easier to then get regulation in other parts of the world as well. So where do things stand now? Based off of that, as far as I can understand, still quite of a pause. I'm assuming, there was a lot of kind of movement with Lycos or MAPS, bringing in new individuals into their regulatory or policy positions. And I'm assuming they're kind of going, I don't know, back to the drawing board, or maybe doing further follow-ups with what they have already, or having to start it again. And these are pretty costly trials. And so having to kind of go back to the drawing board and bring in some of the suggestions and keep going. So again, not a cancellation or a rejection, but just a pause, it seems. Um, and so in the US, MDMA still remains a Schedule I substance, and there's no FDA-approved MDMA-assisted therapy. Research continues, but access is limited and tightly regulated. The field is paused, not abandoned. The moment may ultimately strengthen credibility and safety within this. I think, a lot of people saw it as a big, uh, um, a big rejection, but, it just might be laying the groundwork for a safer, more credible psychedelic industry, one can hope, in the future. So switching a little bit, we've discussed One Health, MDMA in general from our animal patients, and just some notes, not necessarily related, but it's serving as reminders for how we discussed it in our animal patients. I think like anything, as MDMA becomes more normalized in human spaces, animals are increasingly exposed. Veterinarians already see accidental ingestion in dogs, often with can be pretty severe consequences, hyperthermia, seizures, and this serotonin-like syndrome that we've discussed before. So I don't think that changes for us very much, especially often we're discussing MDMA in the regulatory sense of pure MDMA, and reminding or remembering that MDMA is often mixed with other amphetamines in a recreational sense. And so often in a festival sense, there's often a lot of adulteration of these drugs, which can become more dangerous. Um, and ASPCA, as we discussed before, does list MDMA as one of the intoxicants that animals do get into. So yeah, I think nothing changes for us from veterinary practitioners too much. I think one thing that we can maybe, discuss, because I think it's not clearly labeled in these FDA documents or even in any of the research, but we often heard stories of animals being used as support in psychedelic situations, and MDMA, I think, is one that's more common. So other discussions that we've had in terms of um, how animals show up in these assisted therapeutic conditions is something that we at least heard whispers of for sure, or saw examples of in this MDMA. So maybe if they're reframing, going back to square one, that's something where our voices can also be brought into that conversation, both from a scientific perspective that I think we know as practitioners that can change maybe the results that they're seeing, and also from a safety perspective of animals that are being put into that position, and more from the One Health sense, bringing into the environment and the ethics. I think in general, no medicine exists outside of ecology. So pharmaceutical manufacturing, waste, and disposal of all environmental footprints, and I think with MDMA as well. So we also need to consider that. I hope, One Health lens, and something we all recommend trying to bring into this psychedelic conversation, asks us to anticipate these impacts rather than respond after harm occurs. And so hopefully that our voices can be brought into this conversation to not just to focus on our human counterparts who are looking for assistance, but also broadening that conversation as well. And so what's the path forward here? The FDA outlined what moving forward would require, and this includes stronger trial designs, clearer safety data, longer follow-up, and more robust ethical guardrails. Culturally, it also requires less hype and more humility, something we've discussed about before. And we think responsible progress means building systems that can hold these therapies safely and that benefits everybody. So, kind of final takeaway, MDMA regulation isn't just about whether a drug works. It's about whether our systems, scientific, ethical, regulatory, and ecological, are mature enough to support it responsibly. a One Health approach doesn't slow progress. We think it makes progress survivable for people, animals, and the environments we share. Um, and that's what I have for you today. It's been kind of silent, at least from our perspective, in terms of public documentation of what's going on. The science has seemed to stall a little bit. So I can only assume that I don't think people have given up with this. They have seen tremendous clinical results with this type of medication and therapy combined. So I think that that hope is still there. And then maybe just a humbling of the approach and not getting too far ahead of ourselves before checking all our boxes. And so whether for better or for worse, I don't know. This is just kind of where things are landing at the moment, and I expect things to continue. And I'm sure in 2026 there'll be more trials opened up, and having changed their perspective a little bit, um, see something that will meet the requirements. And so, it just might take longer than what I think most people discussed or put out there, and we'll see.
I
So
have a comment more than a question. I really like that one of the last things that you said, Steve, about like we are seeing good results with these molecules, but accompanied by therapy. So that's like a really big takeout because people think like I'm going to drink, eat, or consume whatever magical cure there is, and that's it. And usually it doesn't work like that. So I believe that's really important that we keep like pushing that, that it's not only taking something, but you need someone to guide you through it and to take the therapy that you need because not it's not only taking something. Yes, that something can help you, but probably it's not going to be enough if you are not taking other um, tools to help you with it.
it's made it more confusing in this sense of in terms of drug regulation, unfortunately. And I don't know what that's going to do. And I think understandably from the FDA's position, they're a drug approval organization, and things are very siloed in that sense. And so I don't think they've been approached with something like, okay, you got to take this, but it has to come with these recommendations from this trained source. And I know there's been other broader concerns about that too, of who's in charge of that, et cetera. But I think that of course, trying to keep that pillar of with psychedelic therapies, that therapy needs to be a part of it. But how do you integrate that into a system that is not set up to improve that? And
But
so
I don't think that maybe something like the FDA has not necessarily the power, but it's not in their hands because usually it's like any other drug in the market that you put a legend in the box saying like you need to consult a specialist. And the problem with that is like with cannabis, we don't have the education us as medical professionals. And if you don't even know how to use it and in what conditions you are going to keep like saying, yeah, take this.
I'd add in there functional medicine, which kind of feels like the crux of this is that you you do have to apply the medicines in juncture with the setting, in juncture with the family unit and the systems theory piece. Steve, you used that word as you started. Um, Kind of as a broader question, which we won't focus on, but just to add it to the conversation, I don't feel like this is unusual. We should have therapy alongside any of the drugs that we're using. And from the veterinary perspective, we know that from any of our behavior modifying drugs, but also our pain medications that then should allow us to do rehab, that should allow us to do. So viewing drugs more as that bridge that helps the body be in a state to which the modality can be applied. At least that's how I usually frame, for sure, my thoughts around other botanicals like cannabis. How can this body be in a state where it's most receptive of the modality I want to apply. I mean, I think that could even apply to anesthesia. How can we conduct this surgical intervention? We need the body to be in a state in which that's possible and healing happens instead. So all that to say, I think it's a bigger concept that is just dropped down in the midst of a trial that's making everyone look at it because it crosses much broader concepts than just psychedelics. Um,
Mhm.
but then the other part of that is who's the practitioner? So, Flora, you brought that piece up. How does that practitioner know then they're part of it? And I think that justifiably should slow down drug approval process. If the person who's utilizing it doesn't have that background, then approval is really, I think, difficult to get because the people doing the studies, doing the trials, Steve, as you brought out, there's so much variation. If the therapeutic application is not even worked out. So again, it just felt very fast from the MDMA trial perspective. But here's a thought that I love to throw into conversation for a bit. Who are the practitioners of this? Um, there's such a push for psychedelics to be used so widely with very minimal training. So, sort of for me, across the facilitator spectrum, I have concerns about the lack of biology training in the individuals who are administering substances that are really heavily biology shaping. And Steve, again, you brought that out in the beginning of your lecture, saying that these substances work over long time periods. And so if we're not really understanding what's happening to the body with its application, then how are we even prepared to evaluate safety or even look for negative consequences? Are we looking far enough out? So
Yeah, and I mean, I think that's where some of the concern, whether FDA or broader community as well, or people started to have concerns as uh, in bringing in that double-edged sword of the importance of including psychotherapy in it, but who was I think one entity would have been provided the rights to manufacture, produce, and provide the training uh, that is deemed necessary. And I know they're you know I see it from both perspectives. They were struggling trying to meet the demand and trying to train as many people as possible. Usually it was mostly therapists, psychotherapists, clinicians that were given or opened up to extra training provided by MAPS. I think there were some exceptions in that area of people who were otherwise dedicated towards psychedelic training. And then I think from what I understand, at least one person in that community had that training, and then there was support staff or people that were um, acting as support within their practice. So it's yeah, I mean that's a tough question. I think there's concerns about a monopoly in that sense of who's providing all the training, who's getting the financial incentives for this to go through as well. And that's where, Flora's right. Most medications have, prescribed by your physician, prescribed by this, and those are understandings that it has to go that way. And that's where I think this differed a little bit was it has to be this specific psychotherapy protocol, governed by this specific body. And so I think I could see where that can get messy for people, right? Other spiritual beliefs and other practices into this. So maybe the clinical psychotherapy isn't the right model from a broader context. I don't know, or it's one of the models that can support. And so coming back to your question, I don't know if I have an answer of what would be needed for them to provide uh, support, but I mean, a lot of them are. I think Oregon recently is kind of things are collapsing there in terms of at least their psilocybin work. It was open to a broad context of people and in quite short hours. It was like, what was it? And don't quote me, but a pretty minimal amount of hours to go and provide that therapy. And again, someone might come in with tons of underground experience and be, an excellent provider or facilitator. Um, but in general, a lot of those systems seem to be struggling or collapsing because of, I think, for a variety of reasons. Um, right. In the course I took, that was 3 years. From an indigenous perspective, and from that course was 3 years is nothing to support that, and especially if we are talking about it from that context of people who've been working with these psychedelic substances for all of their lives, then maybe a 6 week online course isn't going to cut it. Um, and that's always and it's a challenge because I know people are suffering and people who are in treatment resistant states, and that this could be very helpful for some, or life changing, and so that pressure is there. Um, but there's also, again, coming back to a more holistic perspective, there's always a sense of urgency. There's always a sense of that someone needs treatment and needs assistance, and but urgency can sometimes push us to things that uh, or conclusions that aren't necessarily true and then cause more issues, right? And especially with MDMA, the abuse potentials, at least from a therapeutic perspective, are real. There's cases that have been documented. And not necessarily even, I think we had the discussion last time of not in that immediate time frame, that it can take months, years for someone to realize, comprehend, or be in a state where they say that what happened to me was wrong. And so MDMA, especially because it opens people up, touch is such a challenging boundary in psychedelic medicines or therapies in general, and lines have been crossed and has been documented. And so, that can be reason enough to slow down. And what are the networks? What are the feedbacks that are keeping people in check? Maybe it's not completely there.
If we have not yet figured out how to do it for human patients, then we need to slow way, way down. What's interesting is I do hear MDMA being picked as a molecule of choice often for use in animals because the human's experience with it has been so positive. I think this is true across really any therapy. It worked for me. I want to share with you. I did this. You should give it a try. But for sure in psychedelics, um, that human's own experience with the molecule or the situation, the scenario, I think really easily leads to anthropomorphism, even on another human. I'm sure there's a term for that that I don't know. Projection, I guess, would be the better one of this is going to work for you in the same way, and not recognizing all the various factors that can kind of be alongside that. Research and use, that I just think the theme is slow down, go slower, think about the timeline, the time frame in which these molecules are working. And that seems really easy to forget a lot of times. Steve, do you know anything
Mhm.
about the other countries that are using this? Canada in particular, how is it being administered? Are there information from those sessions? Do you know, Tammy, do you know?
I'm not finding a whole lot out there. Uh, and so I mean, I think, and if US pauses, there's a general pause everywhere. In Canada as well, Maps were the ones who I think were Maps Canada, were the ones that were sponsoring a lot of the trials.
Hmm.
Um, so yeah, even just trying to like go through Google Scholar and see what kind of publications, and there seems to have been just a general freeze what I can see. Um, I'm sure it's still ongoing, at least in Canada, from the compassionate sign. Has always been more psilocybin that's being discussed first. Um, but yeah, not hearing much in terms of specific cases or outcomes at this point.
I find that really interesting because in my mind, that seems like it would be because, so it's through a prescription route, um, talk to your physician, receive substance, sort of assume there's some therapeutic guidance. I wonder if it's not a situation more like we see in cannabis, that when that practitioner just doesn't know how to work with the molecule, they're not going to use it. They're going to go to something that works for that therapeutic relationship. So that would be really interesting. Maybe we'll try to find a practitioner who is working with some of the substances in Canada or elsewhere, and just I'd love to hear their opinions on that. That would sort of be my guess, though, is that if there's not this push to use it from the industry side, and the practitioner's not super comfortable with what the outcome is or how to apply it, they're going to go back to what works for them, for their practice style, for which patients seek them out.
They also went through this kind of switch of requesting special access and expanded care that put it directly onto the prescribing physician. And I have to see what the changes were, but that made a lot more hesitation for physicians to go through with it. And so, but yeah, this making that kind of subtle switch from a general patient request to the physician having to request or something like that, that just, physician liability said, no thanks. So
Yeah.
I think yeah, there's been a general slowdown with that as well.
So, Steve, you mentioned in the beginning some of the reasons that MDMA has been sought as a therapy, veterans, first responders, trauma survivors. Can you speak a little bit about potential for the veterinary community, whether or not there's necessarily access now or soon? What about just your thoughts about the molecule itself, the therapy itself, for some of the moral injury or hurt that animal care providers are interfaced with? What are your thoughts there?
Mhm. Yeah, yeah, and so I mean, there has been some research in first responders in general. I think some quite promising as well, especially post-COVID. In the States, there was some research related to that. Um, and I think, and that's what, I mean, I remember years ago, I mean, it's kind of what drew me towards it. I saw the most potential for MDMA for our communities. It's a little more, typically more gentle than some of the other psychedelic medicines. And I find, you know, it can really help with that, both those traumatic episodes, and I had the discussion before, veterinary medicine and healthcare work can be micro trauma or macro trauma on a daily basis. And so to be able to reframe some of the events that maybe happen for a lot of people. So I think of, yeah, people who've been attacked, workplace violence, something that we've discussed. So real physical trauma, either from patients or even people I know who've had very severe dog bite injuries within clinic and then are reluctant or hesitant to go back into practice. Could that be something again used with therapies and with support to help to work through or to reframe? Right, and MDMA is very heart opening, very compassionate, and so I think a lot of us are kind of on that edge and even disconnected in a way from our bodies, from our heart, from the reasons maybe we got into veterinary medicine in the first place. And something we've discussed and seen, and I've witnessed in colleagues and I've witnessed in myself too, of this. Um, no, I'm not going to say lack of empathy. I'm going to say loss of empathy from disconnection, from overwhelm, from moral injury, from a long line of reasons that we're not connected to ourselves and we're not connected to the profession as we used to be. And so, not that the empathy's gone, it's just we're in states of overwhelm, we're in a state of despair, we're in a state of unmetabolized grief, which we've discussed. And I think with proper support, MDMA can be very supportive with that on its own, or sometimes combined with therapies, other therapies in different settings. Um, so I see potential for it. From if we're talking from our health workers, it can be really one that is and one that's often used sometimes individually and sometimes communally too. And there's different protocols that need to be followed for that. But a lot of us feel have felt alone, isolated within this profession, and drawing back to that community and connection with our peers, I think could be really powerful. Um, in terms of an animal perspective or a patient perspective, um, again, yeah, 3, 4 years ago, that's the one. Yeah, I think there's so much potential for those animals that are have suffered abuse at the hands of people. Unfortunately, we still have countless examples of that who have lost that trust, or who are, no other option besides euthanasia in different respects. That was the one where I was like, oh, maybe, those are the ones that could in imperfect scenarios, could that offer something for these animals or for these patients or for these clients that have tried everything else? Um, Part of me is still very hopeful for that. Part of me has also seen how the hope and has gone to certain extremes, and the ripple effects, the downstream effects of that it's not an ideal situation, and that we need to be much more cautious and bring so much more harm reduction education into this, because we see how researchers run with things, we see how the public runs with things, we see how different communities and we see, maybe for me, the downfalls or the concerns are more clear than they were before. So I haven't lost hope or promise in that, but a little more cautious of how we approach that and what caveats need to be presented alongside that at the same time, and needing to, control or frame the conversation very carefully, because it's not always presented that way, especially with our animal patients, right? Our owners can be, especially if using some of these substances themselves, can often get into grandiose states and healing or healer states, evangelical states of, what's the harm? And, there's limited oversight or lack of oversight sometimes in the human realm and how to deal with those abuse potential. And I'm going to say there's zero in the animal, or in patients or people who own animals. And, you know, I've seen or witnessed the effects of these kind of grandiose states in human communities, and then, behind closed doors, what could be occurring when people think it's okay to dose their animal. And of course, always when we discuss these conversations, to approach it with a lot of care, harm reduction, awareness, conscientiousness, and us as a community, even though being dedicated to this for several years, we still have a lot of questions and concerns and how to approach. And so anyone who listens to this and takes this as advocacy, it's not necessarily meant. I think the curiosity is there, but from a healthy standpoint of trying to approach this with responsibility, but then also knowing, yeah, what those ripple effects can really be.
What I worry most about is often the human guardian being the one to facilitate the animal's experience. So just like we see in your presentation, that often it's the setting or the facilitation or people not knowing what the right protocol is that can have a lot of harm. We definitely see that on the animal side of the human being not regulated enough to help whatever needs to happen in that animal. So that part concerns me. Okay, last call for psychedelic topic comments. Well done, Steve. Thank you. Round of emojis.